Ebola virus gripping West Africa, the World Health Organization has convened a two-day meeting in Geneva to determine whether the Ebola outbreak poses an international threat and to discuss new measures to tackle the highly infectious disease. Viewers and Look gives us some insight as to why this outbreak is especially deadly.
West Africa is on high alert for Ebola. Airports like this one in Togo are getting ready. Nigeria announced its second case Monday. A Nigerian doctor who treated an infected traveler from Liberia, who later died, now has the virus. Doctors are monitoring those who came in contact with the victim for symptoms. This is, in theory, how you break the chain of infection. You isolate the sick person, and then you watch everyone who had contact with the sick person's bodily fluids. But in the border areas of Guinea, Sierra Leone, and Liberia, the virus spread too fast. People did not know or believe what it was. Some infected people hid or ran away. Families continued to handle and bury the bodies of Ebola victims. And the virus fanned out. Health workers are still trying to catch up. You educate everyone. Ebola is real. It's not a doctor's conspiracy, it's not witchcraft, and it's not always a death sentence. Some people who get medical care can fight off the infection and live. But Doctors Without Borders says communities continue to resist.
In Liberia, Sierra Leone, and certain parts of Guinea, where we are having trouble accessing certain villages, we know there are probably cases there, that people are dying and that the disease is spreading, but we can do nothing. We either don't know about the cases or the population won't let us in because they don't understand we are there to help.
Fear and misinformation can take time to uproot, time these countries do not have. Liberia and Sierra Leone have deployed security forces to protect health workers and enforce containment measures amid hostility. Liberia closed schools and government offices. Public hand-washing stations are set up in the capital. The message is getting out. Liberia is considering quarantining affected zones. Sierra Leone already has. But public health experts say it's education, not enforcement. That's the antidote to fear. And Look, VOA News, Dakar.